So, hey, my name is Sheldon. Today I'll be your student physical therapist. If you don't mind me asking, could you please tell me your name and date of birth?
My name is Jacob Jala. My day of birth is August 2nd, 1995.
Okay. So, Jacob, pretty much what I'm about to do on you is a deep tendon test where I will pretty much test your reflexes. This will kind of help me to understand if there's any issues going on with maybe some of your nerve roots in your spine. So, first I'm gonna start with my uninvolved side here. So here I'm testing the bicep tendon reflex C5 nerve root. See the tendon here. Give it a nice little tap. Looking for a contraction, a muscle contraction. Okay. Pretty good contraction. Next, I'll do C6, brachioradialis here. Right in the middle of the muscle belly. So the camera can see the contraction. Yup. Pretty good reflex. Next I'll do C7, the triceps tendon here. Okay, got it right here. You just relax your arm for me. There you go. Let's see if I can feel it. Okay, I can feel the muscle contraction. So next I'm gonna go to the involved side and test the involved side. So again, we have C5, the bicep tendon reflex. You can just relax your arm. There you go. On that tendon here. Okay. Pretty normal compared to the other side. C6 here. Relax your arm. You can see the reflex in the hand. So we have C7, tricep tendon. And again, you can just relax your arm. Go. Let me see if I can feel for the contraction. Yep, it's pretty normal compared to the other side. So next, I'll move down to his lower extremities. Testing L4 first, the patellar tendon. And Jacob, if I can ask you, could you slide to the edge of the tendon for me, please? And just relax your legs. Okay, let's try this out. So it's not really much of a reflex, but it doesn't necessarily mean that it's abnormal. I can test the other side and it'll kind of help me gauge what I think it may be. Next, we'll move along to S1. Here, the Achilles tendon. And you can just relax. Okay, there we go. Okay, it's a good reflex, okay. Next, I'll go to the involved side, L4, here. Just make sure you relax. As we can see, no reflex as compared to the other side, so it doesn't necessarily mean an issue. Plus, Jacob is still functional, so it's not a problem. See, I'm in S1, the Achilles tendon. I can definitely feel a strong contraction. So those are tendon reflex testing. And so next I'll be assessing Jacob's myotomal pattern. So pretty much a myotome test will allow me to see the innervation of certain muscle groups by certain nerve roots. First I'll start off with C4. So Jacob, what I want you to do is bring your shoulders up to the ceiling, hold them up, and don't let me break. Okay, pretty strong. That's C4. Next, I'll do C5. So Jacob, what I want you to do is hold your arms out. I'm gonna give you some resistance. Don't let me break. Pretty strong. So that's C5. So C6. First, I'll test the uninvolved side. So Jacob, what I want you to do is give me a bicep curl. I'm gonna try to give you some resistance. Don't let me break. I'm gonna stabilize the shoulder here. Okay, pretty strong. Next, I'll do C7. So Jacob, what I want you to do is extend your arm out and don't let me push your arm in. Okay, pretty good, C7. And next, I'll do C8. So Jacob, what I want you to do is extend your thumb, and I'm gonna try to give you some resistance. Don't let me break it. Okay, pretty strong. Next, I'll do T1. So Jacob, what I want you to do is spread your fingers out. I'm gonna give you some resistance. Don't let me break it. There. Strong there. Strong there. So next, I'll move on to the involved side. Where I'll test C6 first. So Jacob, can you give me a bicep curl again? Don't let me break again. Pretty strong. Next, C7. So Jacob, what I want you to do is push against my body. Don't let me break. There you go. C8 once again. Thumb extension for me, Jacob, and don't let me break. There you go. Lastly, for the upper extremities, T1. So Jacob, could you spread your fingers apart and don't let me pull them together. Good. Good. So once again, that was a myotomal testing, assessing Jacob's myotomes, and they're all pretty good. So to continue on the examination, I'll be testing Jacob's myotomal pattern of his lower extremities, starting off at L2. So Jacob, what I want you to do is bring your knee up to the ceiling. I'll give you some resistance, don't let me break. Good job. And this is the uninvolved side first. Next, Jacob, for L3, what I want you to do is try to kick your leg out against my resistance. L3. Next, we got dorsiflexion. So Jacob, what I want you to do is point your toes up to the ceiling with your ankles, and don't let me push your foot now. Next, we have L5. So Jacob, what I want you to do is bring your toe, just your great toe, up to the ceiling, and don't let me push it down. It's L5. Next, we have S1. So Jacob, what I want you to do is point your ankle outward, and don't let me push it in. That's S1. And to test S2, knee flexion, Jacob, what I want you to do is bring your knee back towards the table, and don't let me pull it out. There you go. Next, we want to move along to the involved side. So back to L2. So Jacob, what I want you to do is bring your knee up to the ceiling. Don't let me push it down. Good job. Next, we got L3. So Jacob, what I'm going to do is push your knee in. Don't let me push it in towards the table. L3. Next, I want you to bring your toes up to the ceiling, and don't let me break your ankle. That's L4. Next, we're moving along to the big toe. So Jacob, just point your big toe up to the ceiling. L5, and don't let me break it. There we go. Next is S1, ankle eversion. So Jacob, what I want you to do is turn your ankle. I want you to hold that position. Don't let me break it. There you go. And then finally, S2, once again, Jacob, what I want you to do is try to push your knee out against me. There you go. Good job. So next, I'll be testing Jacob's dermatomal pattern. It'll pretty much give me an idea if Jacob is experiencing any sensation problems in certain areas. And it'll pretty much tell me whether or not Jacob may be experiencing an issue at the nerve root spinal level. First, I'll start off by asking Jacob to close his eyes. And Jacob, I'll give you a stimulus. Just tell me the location and if you feel it or not.
Back of my head.
So that's C2, nerve root.
Back of my neck.
C3, nerve root. Next, I'll test the uninvolved side first. So
Top of my left shoulder.
that's C4.
My left shoulder, the outside.
C5.
My left thumb.
C6.
The inside of the pinky of my left hand.
C8.
And then the middle of my left hand.
C7.
And then the inside of my left arm.
And that's T1. Next, I'll move along to his involved side, upper extremity. Show
Top of my right shoulder.
C4.
Outside of my left shoulder. I mean right shoulder.
C5.
My right thumb.
C6.
The inside of my right hand.
C7.
And then the pinky of my right hand.
C8.
And the inside of my right arm.
T1. So next we'll move along to Jacob's lower extremities while assess his dermatomal pattern. So Jacob, just let me know where you feel it at on your body and if you can feel it or not.
My like left groin area.
That's L1.
My mid thigh of the left leg.
L2.
Top of my knee.
L3.
The inside of my foot.
L4.
The top of my foot.
L5.
Outside of the left foot.
S1.
And then the back of my knee.
That's S2. Next, I'll move along to the involved side. So, Jacob, once again, just tell me if you can feel it and where.
Top, the groin, like L.
L1.
Like my mid thigh.
L2.
Top of my knee.
L3.
Inside of my right foot.
L4.
Top of my right foot.
L5.
The outside of my right foot.
S1.
And then the back of my right leg.
S2. That concludes the dermatomal testing for Jacob. So the next portion of the examination, I will be testing Jacob's cranial nerves. So pretty much testing the integrity of his 12 cranial nerves. I'll start off with cranial nerve 1, the olfactory nerve. So Jacob, what I want you to do is uncover your nose for me, please. Close both eyes and close one nostril. And tell me if you smell anything, and if so, what it is, if you can distinguish that.
Feel like a mint.
Okay, so now could you cover the other nostril for me, and we'll switch sides.
Yeah, I smell mint in my left nostril.
Okay, so the integrity of his first cranial nerve is fine. Next I'll be testing cranial nerve 2, the optic nerve. So I'll have Jacob read from a sight chart standing 20 feet back. And so Jacob, what I want you to do is read the lowest line that you can possibly see. I want you to cover one eye and just try your best.
The lowest I can read is T-O-Z.
T-O-Z. So could you try to read this fourth line for me?
Q, X. Yeah, I can't see it at all.
Okay, so that's a 20 out of 70 reading.
Okay.
Could you switch eyes for me now, Jacob? And try reading the lowest line possible.
Oh, I can see. Is it P-E-C-F-D?
Yep. So that's 20 out of 40. So there is a deficit in Jacob's cranial nerve 2, but he's still pretty functional, so it doesn't necessarily equate to a problem. So the next cranial nerves that I'll be testing is cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerve. So pretty much what I'll have Jacob do is follow my finger. So Jacob, what I want you to do is follow my finger and with your eyes, try not to move your head. So as you can see, Jacob's nerve is intact. Next, I'll do the dilation test. So Jacob, I'm gonna shine a light in your face and just see if your pupils dilate. dilation. Let me do the other eye now. And there is a dilation. Next, test cranial nerve 5, the trigeminal nerve. So, Jacob, what I want you to do is close your eyes. I'm gonna touch your face, and just let me know where you feel that stimulus.
The top of my, the left side of my forehead, the top,
Okay.
like by my right cheek.
Okay. And I'll also test the motor portion of cranial nerve 5. So Jacob, what I want you to do is just chew for me.
Mm-hmm.
Okay. And then chew for me again. Okay, so Jacob's trigeminal nerve is intact. Next, I'll be testing cranial nerve 7, the facial nerve. So, Jacob, what I want you to do is pull your mask down for me. Could you give me a smile, a frown? Could you like wrinkle your forehead for me? So, Jacob's cranial nerve 7 is intact, the facial nerve. Next, I'll be testing Jacob's cranial nerve 8, the vestibular cochlear nerve. So Jacob, what I want you to do is close your eyes for me. I'm gonna give you a hearing stimulus. Just tell me which ear you hear it out of and at what point that you don't hear the sound anymore.
I hear on my left ear.
Okay. Tell me when you no longer hear it.
No longer hear it.
Okay.
I hear it from my right ear.
Okay.
No longer hear it.
Okay. As you can see, the distance is about equal for Jacob, so it's normal hearing on both sides. Next, we'll jump right into the cranial nerve 9. So I won't be testing cranial nerve 9 because of COVID precautions, but I would test cranial nerve 9 by using a gag reflex. So I'll skip 9 and go straight to cranial nerve 10, so the vagus nerve. And cranial nerve 9 is the glossopharyngeal nerve. Cranial nerve 10, vagus nerve. So Jacob, what I want you to do is pull your mask down for me. I want you to open your mouth wide and say ah.
Ah.
So here I'm looking at Jacob's uvula, seeing if there's any deviation to a certain side. Jacob's uvula here is normal. So his vagus nerve is intact. So for cranial nerve 11, you can pull your mask back up too for me, Jacob, please. Cranial nerve 11, spinal accessory. I'll be testing Jacob's spinal accessory nerve. So Jacob, could you give me a stroke, please? I'm gonna try to give you some resistance. Don't let me push your shoulders down. So Jacob's cranial nerve 11 is intact, and Jacob's final cranial nerve 12. What I want Jacob to do for me is pull your mask down and stick out your tongue. So here I'm looking for any tongue deviation. Here, as you can see, Jacob's tongue sticks straight out, no deviation to any side. So that lets me know that his cranial nerve 12 is intact. So that concludes the cranial nerve testing, and yeah. So the next portion of this assessment will be a postural exam where I'll examine Jacob's posture, maybe see if we see any abnormalities. So we're starting off in the anterior view here. So looking at Jacob's head, it's pretty symmetric on both sides. Could you pull your mask down a bit for me, Jacob? Pretty symmetric on both sides. The mandible look aligned. Ears look aligned as well. Yeah, pretty normal. So his shoulders here, they're pretty normal. I don't see really a huge abnormality between the two. Maybe a slight raise in his right shoulder, but it's not anything pretty noticeable. Looking at his rib cage from the anterior view, looks pretty symmetrical. I don't really see any abnormalities there. As far as scoliosis from the anterior view, we really can't see any abnormalities here. Looks pretty solid from the anterior view. As far as the pelvis, so I'm gonna take a look at his ASIS to see if it's aligned and even here. So it is pretty even, it's aligned. Don't really see any abnormalities there. As far as his hips, like I said before, pretty aligned, no abnormality. So now we'll take a look at his lower half. So here we see his femurs. Femurs are pointed the same way, kneecaps pointed the same way. It's pretty normal comparing the two sides. The definition of his quads, pretty normal, no big difference. As far as his tibia, they are pointed straight in the same direction, so that's pretty normal. I do notice from the anterior view a bit of a slight bit of more definition in his right calf. Are you right-footed, Jacob?
Yes, I am.
So that could be attributed to him being right-footed. As far as his knees, I mentioned before, they both point straight out, so it's pretty normal. Patella position, pretty normal. As far as his tibias, I already mentioned his tibias, they do point straight out. So his ankles, from the front view, I do notice maybe a bit of a hallux valgus. So his big great toe do point inward a slight bit, but it's not really causing any functionality issues. So right now it's not a problem. From the front, I do notice that he do have a bit of an arch, so it's pretty normal. His foot arch looks pretty good. His toes point straight out, so I really don't see any abnormalities there, aside from the great toe. His leg length look about the same, so no abnormalities there. And yeah. So next we'll take a look at Jacob's lateral side. So before even assessing his posture, I'll first look at the alignment of his lateral view. So as we see, the pike here does goes through the tragus of the ears, which is what we're looking for. Goes through the tip of the shoulder, slightly posterior to the hip, slightly anterior to the axis of the knee, which is normal, and it does align slightly anterior to the lateral malleolus. So his alignment is pretty normal. So here, as we can see, his head is pretty normal. It's not forward-headed or anything of that sort, or extended. Could you pull your mask down for me, Jacob? Looking at his mandible, is not excessively protracted or retracted, so it looks pretty normal. You can pull your mask back up for me, Jacob. So taking a look at his scapula, I don't see any sort of winging, so it looks pretty normal. As far as thoracic kyphosis, I really don't see any excessive kyphosis. His shoulders may be a tad bit rounded, maybe, but it's not really much of a big notice. In terms of his lumbar lordosis, it looks pretty normal. I don't see excessive lumbar lordosis. Looks pretty aligned. And as far as his knees, he may be a tad bit hyperextended in the knee, maybe, but it's not really a big notice. So for Jacob, this could be normal. And as far as his arch, from the lateral view, Jacob does seem to be maybe a slight bit flat-footed. But as far as functionality or pain, if there is none, then that's not necessarily a problem. So now I'll be assessing Jacob's other lateral side. So as we can see with the head, it's pretty straight. Jacob, if you don't mind, could you pull your mask down for me, please? Mandible, it's not too much retracted or protracted. Don't really see any scapular winging. Jacob, I'm gonna ask you to step up for a second, right there for me. Maybe just like maybe step back and stuff. Yeah, right there. No winging going on here. It's pretty normal compared to the other side. Looking at his thoracic spine, I really don't see too much kyphosis from this view. Seems pretty normal here. Looking at his lumbar spine, don't really see any lordosis, maybe a slight amount of excessive lordosis, but nothing major. Dropping down to his pelvis, seems pretty normal compared to the other side. Looking at my pike here, it does go slightly posterior to his hip, so it lines up correctly. As far as his knees, maybe a slight bit of hyperextension, maybe. But the pike does go slightly anterior to the axis of his knees, so pretty good alignment. As far as his ankles, does go slightly anterior to his lateral malleolus, which is normal. From his arch, his longitudinal arch is a bit flat, but it's pretty normal compared to the other side. Hasn't had any complaints of pain or functional issues, so it's not necessarily a problem. So now I'll be examining Jacob's posterior view. So just looking at his alignment, his head is pretty forward. In terms of his scapula, they look pretty aligned. Really don't see any asymmetry. It looks pretty normal. As far as his shoulders, so his right side may be slightly depressed when compared to his left side. Doesn't necessarily mean it's an issue if it's not causing any pain or functionality issues. If we look at his ribs, so as we see here, there is a little bit more of a crease here, so could tell us that his ribs may be slightly asymmetrical. But it's not very noticeable, but you can see it. In terms of his pelvis, so I want to assess his PSIs here. Pretty symmetrical, they align straight across, so there's no issues there. So I do want to look at his knees. So I want to look at the crease of his knees. They both go in the same direction. Look at his hamstrings. Definition of his hamstrings pretty symmetrical. No abnormalities there. His right calf may be slightly bigger than his left calf, more defined. So I'm assuming, as earlier, that Jacob is right-footed. So looking at his ankles, they don't look significantly inversed or eversed. So pretty normal. In terms of his calcaneal position, again, normal. It doesn't look very inverted or everted. So yeah, I really don't see any issues there. His alignment from the posterior view is pretty normal, aside from just a few things. So Jacob, I just want to run over your postural assessment, just kind of tell you what I saw, maybe give you a small diagnosis. So pretty much I noticed that your left shoulder was slightly elevated, could be caused by a tight upper trap. So maybe just trying to stress that upper trap, maybe trying to strengthen it as well a bit. As far as your ribs, I saw a slight depression of the left rib as well. Could be because of your spine, but I would have to do more assessment to pretty much figure out what that is. As far as the your lower half, so your right calf was more defined, so it just lets me know that you're right-footed, more prone to using your right leg for things. So maybe just trying to strengthen the left leg. It's not necessarily a problem because there is no pain or any functionality issues, but yeah. So as far as the knees, I did see slight hyperextension of the knees. No functionality issues, no pain, so it's not a problem necessarily. And as far as your feet, I did see hallux valgus, so it just means bunions, which means your great toe point inward towards your other toes, not a lot of space in between your toes. Could possibly cause balance issues in the future maybe, and then it can kind of change the function of your walking and running pattern. But as of now, it's pain-free, functional, so not necessarily an issue. Overall, you do have pretty good posture. Didn't really see any huge things. Pretty functional person, no pain. So all of the deviations that I saw is